Her Option, treatment for heavy periods right in your physician's office.
Life after the Her Option procedure has been a big smile for me in an everyday life.
Since I've had the procedure, things are great, excellent. I don't have to worry about the heavy bleeding, the embarrassing moments.
I no longer have the questions. I can feel free to wear whatever I want.
I'm free all the time. I don't live by calendar anymore, counting every 28 days.
It's been a big plus for me.
I'm really just the envy of all my friends right now. This was the best thing I've ever done.
I'm a wife and mother of 2 kids and have the typical busy life. Getting up, getting the kids to school, and trying to manage all the daily activities of a household. My cycle before the Her Option procedure was typically about 7 to 10 days of really, really heavy flow. It meant that I couldn't leave the house, I couldn't be with my kids, and I couldn't go about my daily activities. Running marathons for me is a big part of my life, and during this time when I had such heavy periods and heavy flow, there were days and weeks where I literally could not go for a run. And not only is that disappointing on a daily basis to not be able to get out of the house, mentally it was so frustrating to not be able to do something that I love so much.
Patients have to evaluate whatever problem they are having, whether treatment is necessary. The patient has to decide whether her menstrual periods are intrusive, heavy, affecting her daily activities enough that she wishes to consider some type of treatment.
I started talking to my physician about my heavy periods at the urging of a good girlfriend. We were out on a run, we were talking about our lives, and it just kind of came up, and I assumed again that this was just typical, and she really urged me to go into the doctor's office and find out what options there were for me. When I went to the doctor's office to discuss what could be done, he presented to me several choices. There was hysterectomy, there was going on the birth control pill, there was waiting just to see if this would continue for a couple years, or the Her Option procedure, which I found very interesting.
If the patient feels that her periods are heavy enough, that they're interfering with her daily activities, that the heaviness is really affecting the way she feels about herself, then treatment would be necessary. Once she's reached that point, the Her Option procedure is an excellent choice for her. Minimal discomfort, office-based, no general anesthesia, minimal time off of work. It's definitely a good choice.
The 2 things that really sold me on the Her Option procedure were the ease of the procedure itself and the short recovery time.
The real benefits to the Her Option procedure are the fact that it's an office-based procedure. Patients do not have to go over to the hospital. There's no general anesthesia. Usually office time is only an hour or so that the patient is inconvenienced. The fact that there is significant less scarring with cryoablation versus heat-based ablation is another big benefit in my mind.
The day of my Her Option procedure went very smoothly. It went just as the doctor had said it would.
When patients arrive for the Her Option, it can be morning or afternoon. Because it's an office-based procedure, they can come at any time that we schedule them. Once they check in, they meet with the nurse, make sure that all their questions are answered. We do want them to have a full bladder, so a lot of them are drinking water when they get here. We have given them some pre-medications to take, such as pills, which are pain pills, narcotic-based pills, and a relaxant type of pill, so that they're very comfortable during the procedure. Then they are brought into the ultrasound room. Our ultrasound tech will do an ultrasound to make sure their bladder is appropriately filled for the procedure. As long as it is, then we would perform the Her Option cryoablation, which usually takes around 20 minutes.
I arrived at the office a little early, and I was a little nervous, but as we started to go through the day, my mind was put at ease. There was really minimal discomfort, very similar to an annual exam, and I went home without any pain medication.
Your appointment for the Her Option procedure will take about 1 hour. The actual procedure lasts approximately 20 to 30 minutes, and you will remain in the office for a short period after the procedure. Your physician will prescribe medication to be taken prior to arriving at the office. The medication will vary depending on physician preference and may include one or more of the following: a pain medication, a relaxant, and/or an antibiotic. You should have a light meal prior to coming to the office, and your physician may ask you to drink water prior to arrival to ensure that you have fluid in your bladder. The HER option procedure reduces your heavy bleeding to a more normal or minimal flow by treating the endometrial lining of the uterus with cold temperatures. The cold temperature has a natural numbing effect that may help to minimize discomfort during the procedure. The procedure begins when the slender HER option cryoprobe is inserted through the vagina into the uterus. The probe is thin, similar to devices utilized for an annual exam. The centimeter markings on the cryoprobe act as a guide for probe placement. An added safety feature of HER option is the use of ultrasound guidance, allowing your physician to view the procedure as it is taking place. Once the probe is in place, the cooling process begins. As the probe cools, ice forms around its tip, freezing the uterine lining. After the first ice zone is formed, your physician will warm the probe and repeat the freezing on the other side of the uterus. Depending on the size of the uterus, a third freeze may be performed. The area impacted by the coldest temperatures is the treatment area shown here. The entire process takes approximately 20 to 30 minutes. After the procedure, you may experience mild to moderate cramping, similar to menstrual cramping, along with fatigue and a watery discharge. The watery discharge may continue for 3 to 4 weeks. Your physician will prescribe pain medication for the cramping, and you will be encouraged to go home and relax. You should be able to resume normal activities the next day.
The day after the procedure, the doctor had told me to expect a little cramping and to feel a little fatigued. I actually didn't have any of these symptoms and went out for a run the next afternoon.
We counsel patients that after the HER option procedure, it can take anywhere from 3 to 6 months to see a significant reduction in their menstrual flow. Patients sometimes will find that the periods are lighter right away, but in general it takes each month to see it become lighter and lighter to the point where they get significant reduction in their menstrual flow.
The outcome of my HER option procedure has been fabulous. I went from having 7 to 10 day periods to virtually having no period at all. Occasionally I'll have 1 day of light flow, but nothing compared to how it was before. I know it sounds crazy, but my life has completely changed since the HER option procedure. I can enjoy all the things that I used to enjoy in my 20s to 30s. I can run when I want, I can be with my kids, and I don't have this constant interruption and constant weighing on my mind that I'm not going to be able to leave the house. When I'm with my girlfriends and the topic of heavy periods comes up, I'm very quick to tell them about my wonderful experience with the HER option procedure. I would tell anyone who has this issue in their life to contact their physician and really find out what their choices are.
To learn more about HER option, talk to your physician and visit us on the web at heroption.com.